A hormone called prolactin has many functions in the body, including milk production after delivery. However, its raised levels can be the cause of infertility. We will see how and what is the optimum time for testing blood prolactin levels as part of infertility diagnosis program. First, let us have some idea about prolactin. It's a hormone made of protein, mainly produced by a gland located at the base of the brain called the pituitary gland. Pituitary gland sits in a bony structure behind the nasal bridge called the sella turcica. It has two main parts: anterior, the front part, and posterior, the back part. Prolactin is made by cells called lactotrophs in the anterior part. Besides the pituitary gland, other tissues of the body can also make prolactin, like the central nervous system, the immune system, the uterus, and the mammary glands. Things like nipple stimulation, light, smell, and stress can all kickstart prolactin production in these areas. Certain substances can also increase prolactin levels. For example, thyrotropin-releasing hormone, estrogen, and medications known as dopamine antagonists, used as antipsychotics, can all stimulate prolactin production. Prolactin is typically low in women who aren't breastfeeding or pregnant. However, during pregnancy, the number of prolactin-producing cells in the body increases. This helps prepare the breasts for milk production. Prolactin plays a crucial role in enabling milk production during breastfeeding. Prolactin stimulates the cells in the breast to synthesize the milk components, like a milk sugar, milk proteins, and fats. The strongest signal for prolactin production comes from nipple stimulation during breastfeeding. This mechanical action activates nerves in the nipple, which send signals to the nervous system. These signals block the release of dopamine, a hormone that normally limits prolactin production. At the same time, the body produces oxytocin, and oxytocin helps release milk from the breast. After childbirth, prolactin levels don't stay constantly high. Prolactin rise only when nipples are stimulated during breastfeeding. This helps regulate milk production. When breastfeeding stops, prolactin levels return to normal, and milk production decreases. If a mother doesn't breastfeed, her prolactin levels return to those of a non-pregnant woman within 1 to 2 weeks. If a mother doesn't have enough prolactin, she won't make milk. In contrast, high prolactin levels lead to menstrual irregularities and infertility. When prolactin levels are too high in the blood, it's called hyperprolactinemia. Patients with hyperprolactinemia might not show any symptoms, or they could have issues like low sex hormones and high milk production. Prolactin inhibits the production of gonadotropin-releasing hormone, leading to suppression of luteinizing hormone and follicle-stimulating hormone secretion. Too high prolactin levels can prevent ovulation and stop periods. In less severe cases, high prolactin levels may only disrupt ovulation occasionally. However, this might cause intermittent ovulation or delayed ovulation. Such women may have irregular periods. Some women with less severe cases of high prolactin might not produce enough progesterone after ovulation. This is called a luteal phase defect. This deficiency can make it harder for the uterus lining to support embryo implantation. As a result, some women might experience their period shortly after ovulation. Prolactin levels can be checked with a simple blood test, usually best done in the morning after fasting. While prolactin is linked to sleep, it doesn't follow the daily sleep-wake cycle. It peaks between 4 a.m. and 7 a.m., so mid-morning is ideal for testing. Food minimally affects serum prolactin levels, so fasting is generally unnecessary when measuring prolactin levels, except in cases of mild initial elevation. For women with regular cycles, testing should ideally be done early in the menstrual cycle, around days 2 to 5, when prolactin levels are lowest. This timing helps get an accurate baseline for diagnosis and treatment. It's important not to test prolactin immediately after a breast exam. This is because women will have high prolactin levels because of the exam, and therefore they may show false or transient increase in prolactin levels. Also, prolactin should be tested before ovulation because levels naturally rise afterward. If high prolactin is found in someone without symptoms, It might be due to stress during blood collection, so a repeat test a few days later is advised. Again, for women, retesting during the early part of the menstrual cycle ensures accuracy. Sometimes, an inactive form of prolactin called macroprolactin can be measured as increased prolactin, thereby falsely affecting the results. Laboratories should test for macroprolactinemia in all samples showing elevated prolactin levels in order to rule out the presence of macroprolactinemia.